This is a professional opportunity for you to learn about some of the implications and influences of aging on human sexual expression and on all of the aspects of what sexuality really means. And as a boomer, and I happen to be the first wave of boomers, I was born when, I'm going to show you the stats on the first wave of us was in 1946. So if you do the math really quickly, how old is she? You'll figure it out. And many of us who are boomers are kicking and screaming into the night and day about aging. And so that's a really important thing to understand, is that boomers don't want to age, they don't want to get old, they don't want to not be sexy or sexual, and they're struggling because this body ages, whether we like it or not. And there are huge implications for how that affects our sexuality, our libido, our function, our capacity for sharing, connectivity, and pleasure. And I'm going to walk you through that. So I decided to call this, and how many of you are boomers? Be brave, raise your hands. Yes! And how many of you work with boomers, including those who are boomers? Terrific. Because it's a tough population to serve. You know, it's one thing if you have all of the information in the world, and I am a clinical sexologist, so I wear filter or lenses as I look at the world. That's very empowerment based, it's very sex education as a foundation, it's humanistic, it's pro-sex, sex positive. And when we're serving the needs of our clients who are boomers, there are real roadblocks that they're going to face, even though we'd like to say, well, you can have the whatever it is that they're seeking from you. I work as a clinical sexologist and as the pioneer of sex coaching. I'm going to walk you through very quickly what that means. I actually am not a therapist, and I don't work with emotional states. In coaching, we elicit emotions, but we do not process emotions. And in coaching, we do not look at the past. We honor and acknowledge the past, especially as the past shows up in the present toward their future. But we don't hang out in the past. That's the job of therapy, and many coaches refer out. It's a phrase in my book, The Art of Sex Coaching, that appears on every 4 pages. So let me just kind of walk you through, and I'm going to be turning my body to look at this, and I think wearing my glasses is probably going to be much more favorable for me and you. So there's kind of a sassiness to why I created this title, which is How to Find Your Sexy, because that's what a lot of boomers are on a quest to do. How to keep your sexy, how to find your sexy, whatever that means to them. And with joy, health, and pizzazz, and especially health. That's going to be one of the themes that impacts and impedes boomers from experiencing their full sexual potential, especially for pleasure and satisfaction. Just as a disclosure, I am the co-founder of Sex Coach U, or Sex Coach University. This little idea of bringing my book alive now is training students in 66 countries. And so this is a phenomenon, the sex coaching world, and that's why I want to share a little bit about it with you today. You can go look up my bio. I'm not going to bore you reading it, and you heard a lot about me. But what I want to talk about today, as much as I can, because we're really truncated in terms of time, is what is sex coaching? How does it work? What is the context of sexuality for boomers? How do boomers think? You know, that kicking and screaming against aging is part of the thought kind of soup that boomers are, right? That we are all living in, those of us who are boomers, like, I'm not going to get old. And I'm 72. You probably did the math by now. So this is 72. And it's not what our mothers and our grandmothers saw as 72. So there's a new paradigm that's happening today. And we'll talk more about that. What are the 2 main clinical models? I'm going to dance you through those really rapidly. One is PLISSIT, and how many of you know PLISSIT? All of you should know PLISSIT. All right. And the other is my 5-part holistic model, MEBES, which is a 5 parts of the sexual self-assessment and diagnostic tool, but also a treatment tool. Well, I'm going to take you into that. What are the issues around sex and aging today? And I'm going to share with you a real life case example. and then draw some conclusions. So sex coaching began 1993, the same year I earned my PhD at the Institute in San Francisco, which is now closed, sadly. And that's also where Dr. Katahakis earned her doctorate. And many of us are leaders in the field of sexology worldwide who graduated from that esteemed institution, and I was also a professor and a dean. And what happened is, as I was formulating how I wanted to work, having sex therapy training, being a sexuality educator, I also at that time was looking at something fresh and new and exciting called coaching. And it was Thomas Leonard who started CoachU.com, and it was a way of working with ourselves or our businesses or our clients in moving our clients forward toward their stated goals in a dynamic, collaborative, exciting way. And so as the pioneer of sex coaching, I actually married the field of sexology, or the study of human sexual behavior and its impact on self and on other and on the environment. We have to add that. And using coaching as a way, as the how. And so the next phase of Sex Coach U and in sex coaching, and what the missing element seems to be today, is business training. And so Sex Coach U is about to launch its third aspect, making it a triadic model of sexology, coaching, and business success, because that's what my students and my graduates are longing for. And I imagine that in the mental health care field in general. That's what you're not getting in grad school. And you need it. You need to be able to make a living to do the work you want to do. So I'm not going to say much more about it, but I want to be sure you understand that this is what sex coaching looks like. We're not having sex with our clients, and neither are sex therapists. And so there's a lot of work we have to do and struggle to really substantiate ourselves as professionals, those of us who work in sexuality. And that's a pushback in terms of how we work with boomers as well. And we deal with all the things that Doug was talking about that the center deals with in terms of sexual dysfunctions, sexual challenges, sexual issues, and concerns. And our goal is really the healing and the growth of our clients, whatever age they're at. And so I'm not going to read this, but you have this in your handout. I'm going to skip slides as we go along because of time. But sex coaching is not a lengthy experience with a client. It's very psychoeducational. It's very much about a couple may come to see me who are sexless, the main concern among most couples today. And they may say, we just don't know how to get started because maybe he had a heart operation and she's not feeling very sexy in her skin. And how do we get this client to, how do we get them to start touching, even touching? How do we get them to begin to connect again, to want, to feel their desire, to feel okay about who they are in their bodies? And that may be only a few sessions. Sometimes I have clients who see me only a few times and they got what they came there to get. So it's not an 18-year process, which I have had clients who are in therapy 18 years and in all that time never once discussed sex and sexuality. And I mean that. This is part of why my passion is so strong to train professionals around the world, particularly medical and mental health professionals who don't have the human sexuality training. You're in a very special place here because this is one of the few resources in Los Angeles and Southern California that offers ongoing training in sexuality to professionals and that has a staff, a cadre of trained and competent professionals working around sexuality. So this is what's going on for some of the boomers. The cartoon reads, when I said we need to put some magic back into our marriage, ... Okay, and that's really what many of them are longing for. Not playing cards, but having some magic and the spark come back. So here's what's going on statistically around boomers. And boomers are spurts of growth in terms of population. The baby boomer generation that we're all a part of, most of us in this room, is actually post what? World War II. When the soldiers came back, boom, suddenly there's a surge in birth rate. And right now, 77 million boomers exist in the United States, and 20% of California's population is boomers. And the years are 1946 to 1964. So anyone who is 55 to 73, I'll be 73 in November, but I have peers born in my year who are 73 already. That is what we mean when we talk about the baby boomer generation. And I'm going to say to you that we really need to not put that in the same box, so to speak, when we're serving clients' needs. Because I'll bet some of you are aware that if you have a 55-year-old individual and or couple, the needs are really different than they are when they're 72. And that has a lot to do with socialization, with norms and memes, with permission that they've experienced, and with the body. So we'll talk about the body. But some of the reality is that there are a lot of boomers who do not ever want to give up being sexy and sexual. And what a lot of them find is that they can't. So I'll articulate that when we look at one of these case examples. Another thing that's happening is that a lot of boomers are not retiring. Any of you who read stats about finances and retirement figures know that the boomer generation is not exactly wealthy, and that many of them would like to retire at a certain age but don't have the financial means to do so. So they're also dealing with that stressor, and those of you who are psychotherapists understand that, right? Like they're dealing with the stresses of family change. They're dealing with the stresses of aging within their bodies. They're dealing with relationship and relational issues. And they're probably also maybe looking for work, if not be widowed or a widower, and then out in the dating scene, which is, I would love to do a whole talk on that. So there are new role models. And that's the good news. Look at what we're looking at now. I don't know how many of you have seen Our Souls at Night. It's fabulous. Go rent it. Or The Old Man and the Gun. I think it's The Old Man and the Gun. I can't read it. Terrible movie, but poignant about aging and sexuality. And of course, Grace and Frankie. Who, I'm not going to get into their story, but you should see it and know about it. And even, do you get the spunky vibe? Like the ad says, too old for this shit. So, you know, there's that spunkiness that the boomer generation has. Now, Jane Fonda is way beyond boomer age, okay? What a role model for sexy aging is she. And so there's this movement toward having faces and conversations and film and television that really reflect our story. Another great one that I didn't put up is the Kaminsky method. And I didn't put it up because it's so much about the two men. But there's also a dead wife who shows up and sexual interludes with young women. And the book club, yes, I forgot about that one. So yeah, fantastic. And there are more. I could spout out 20 movies, but I just wanted to show you the new norm right now. So there's a lot going on inside the heads of the boomer generation. And part of it is, this is me speaking, but I perceive it as a second adolescence. And when I used to teach sex education or talk about the lifespan of sexual development, there was always this fun thing talking about adolescent sexual development, which is that adolescents are stuck in the 3 I's: invulnerability, immortality, invincibility. Sound familiar? So there's this second adolescence going on for a lot of the boomer generation, and they're also in denial of and not prepared for death, their own or those around them. And so there are these idealistic expectations about everything, including sex, and there's a decline in functionality, as I mentioned earlier. The good news is that boomers don't have to worry about risking getting pregnant. But they do have to worry about the risk of an STI, sexually transmissible infection. We don't call them diseases anymore, STDs. And also, the safer sex stats are really horrible in terms of those among boomer generation ages who are competent and willing to use safer sex measures, such as condoms or dams. So they're also, and I don't, how many of you work with the sexual function of your clients and serve men who are rapid ejaculators. Okay, so it's the single most common issue that men have, sexually speaking, and why they seek out help. It's called PE, or premature ejaculation, in urology. I do not like that term. I use rapid or early ejaculation. It's depathologizing a behavior rather than judging it as premature. Too early for what? And so what happens is, as men's bodies age, and of course this entire presentation is focusing on cisgendered males and females, just so you're aware of that. What happens is, as aging happens, we don't have any rapid or early ejaculating men, because that's a sign of youth. That's a behavior of younger men. And so that's good news, because it's the single greatest issue that many of us have to deal with when we have male clients. So many of my cases are, oh, I come too quickly, I'm an early ejaculator. I don't know what to do, it's ruining my girlfriend and my relationship. Okay, or my boyfriend and my relationship. That is something we can address, but older clients, older couples, older individuals have delayed ejaculation. So they're slower to experience orgasm and then ejaculation. By now, I hope you all know, who work with males, that they have a two-phased orgasmic response. First orgasm, then the ejaculatory phase. And so for men, we can intervene where that pause is and help them with both early and rapid ejaculation and delayed ejaculation. But delayed ejaculation clinically is actually harder to treat, because often it's about safety and security and trust with a partner. And so that's another lecture. The other thing is that there is such emphasis, and I don't see them on the nightly news as much as I used to. The 3 ED drugs, what's the first one that ever came out? Viagra. So Viagra, then Levitra, then Cialis, and then Cialis daily, which is what I often recommend a lot of my rapid or early ejaculators, by the way, to get them back on track. So the 3 ED drugs do work. They're designed to sustain an erection, but they don't produce an erection. And lots of older guys can't get it up. They can't produce an erection. Their function isn't there. Their response isn't there. They need more intense arousal stimulation, perhaps. They need more time. And yet, again, boomer mentality. I'm not old. Why am I not the way I was when I was 20? What's wrong with me? So we have to deal with it. We have to deconstruct these beliefs for our boomer clients and help them self-soothe, help them give themselves permission to, it's okay that it takes longer. It takes longer for females biologically to experience their orgasm. Not achieve their orgasm, experience their orgasm. Again, language that is depathologizing. So I find that the ED drugs often do assist a client in reestablishing a foundation of confidence, interestingly enough. It's not that it's a treatment that cures erectile dysfunction, but I call them erectile difficulties anyway. I don't use medical model terms. And my clients like that I don't. And what happens is, often men who then do sustain an erection because they've used the helper of a daily Cialis or a Cialis, they're reestablishing themselves as functional males. And then they can do it the next time without the drugs. So this is a very important part of understanding the pharmaceutical influences that even our boomer clients may need to know more about. And the other thing is that there's a kind of mentality among sexologists and sex therapists, and that is that let's just take our older clients and tell them to be sensual, right? Even at ASEC you see commentary about that. Oh, sensuality is enough. Or just experience the ride. We're here for pleasure. Oh my God. It just irks me to no end. Yes, we want to take the pressure cooker out of the conversation of getting to orgasm. But for many people, the goodies are an orgasm. And even from the health benefits standpoint, they're an orgasm, except for oxytocin. Whole other conversation. So it's very important that we do encourage our older clients to go sensual, to spend more time, to do more touching and massaging and caressing, all the good sensate focus methodologies. But there's nothing wrong with helping them and encouraging them to also be sexual. And I'm not going to define that right now. And last, pleasure products. How many of you know what I mean when I say pleasure products? Yes? So what are they? What is a pleasure product, for example? A vibrator.
Dildos.
A dildo. Lubes. Okay? Lubes. So older women in particular need lube, usually. Not all. I have clients in their 80s who are fountains. And I have clients in their 40s who need lube, and even younger. So you need to be schooled in what's out there, because a vibrator, I'm associated with lovingsex.com. That's the Alexander Institute. I'm like the doctor on duty there. I've made 40 programs for couples enhancement video stream. And not all there, but I'm the kind of doctor there. And they have a store, and that's curated the finest sex toys and pleasure products from around the world. And I know many of those toys. I've evaluated them for them, and there are 400 of the top toys on that website. Go to the pleasure chest. If you haven't gone in a while, right? That's your resource. You need to know what's new, what's coming out, all the technology changes, all of the options for when an older woman or an older man, and then we have people who are alone and need an outlet, and people who are coupled or in trios who need assistance. There are so many different devices today. There's always going to be something for your client. And you need to be schooled about what's out there so that you can be a resource for your client. I take my students who come to the SAR program I lead twice a year. Our field trip in the middle of SAR is to the pleasure chest. And every single time, twice a year, I'm like, oh my God, I thought I knew it all. But I don't, because you can't. It keeps changing. And it's so exciting to offer that to one of your boomer clients. Changes in the body, a lot of the changes that occur for our clients. Oh, I'm sighing, because so much of it is the story you tell yourself, isn't it? It's like, I should not have, or those of us at this age, could you take the photo with my hand? No. We need to love the skin and the shape we're in, right? Yes. And we don't. So that's a huge piece of the work with boomers around their sexuality and their pizzazz. It's helping them find the positives. And in sexology, we have specific methodologies and exercises that we've used over many years that work to help with body image issues and mindfulness. And new norms of relationship. That's another kind of backdrop that's going on. There was a wonderful book about a decade ago. Two sexologists did a survey around the entire nation. And one of the interesting findings in this study was that older women tended to be much more open to same-sex relationships. And that there was more permission, there was more availability, because we have to look sociologically at what's going on as well in the backdrop. And so for many boomers, changing the form of relationship and or we as their clinician need to be mindful of what else is impacting them. We have a lot of people in our generation who are now caregivers and also maybe inheriting their children and their grandchildren. Okay, so that impacts their sense of their sexual self and also their ability to be sexual. Even a time management issue may be part of the problem. I can't tell you how many clients, the main thing we begin to talk about is, how do you manage your time? No wonder you guys aren't having sex. Let me look at the roster of what you're doing. When Jimmy Fallon comes on at 11:40 at night is when you think you might try. So this is part of the work as clinicians, and it's very coachy what I'm saying, but it's also as clinicians and educators and for yourselves, what we need to implement is good time management so that sex, however you define that, either alone and or with a partner or partners is a priority. That's part of what's missing for everyone. And one of the reasons also for that, and I don't have it out, but many of you did when we just were coming into the room, is this. What does this represent? It's hijacking everyone's lives, not just their sex lives, their lives. So anyway, other lecture. So also there are some other phenomena, and I realize now I'm probably not going to get to all of what I want to share with you, but you have the slides. There's some other issues going on that nobody talks about. I did a webinar, and I was part of a book project with Joan Price. She's one of the most important names you need to know, Joan Price, who's written a series of books on aging and sexuality, including one called Naked at Our Age, for example. And she's about to release her next book on sex and grief. We don't talk about that. The intersection of where grief, loss and grief, affects our ability to express sexually is like it's undercover. Not under the covers, it's undercover. And this is a conversation that as clinicians you need to be having, because there is a link. When we're in intense grief mode, there's no way we can be sexual. It's not an antidote, which it is for pain, for example, other than vulvar and sexual pain disorders. So also some other things that are going on in the backdrop, because this is going to help you serve your clients, being mindful of it, is we talked about safer sex, we talked about finances, online dating. Oh boy. What a minefield is online dating. Especially for boomers, some of whom are recently widowed, for example, or widowers, and they don't have a clue how to go about navigating this, right? I mean, not a clue. And it's so overwhelming. And I'm doing it right now, because I'm 2 years out from losing my partner. And so it's like, okay, get out there, Patti. And it's daunting. And I'm an expert. I coach people on how to do this. It's daunting, and it's really disappointing. So that's a conversation we could have at another time, perhaps. But also, look at well, we are all in Southern California, where we see the results of cosmetic surgeries every restaurant we enter, don't we? And what is someone's real age? We have no idea. But we know that we're seeing distortion of healthy, beautiful aging. That's what I'm going to tell you. So we need to be a voice for that to not be the case for our clients if we can. And then looking for the golden ticket. Everybody's looking for, what's that drug? What's that toy? What's that answer? What's that dating coach? What's that? What's that? What's that? And it doesn't exist. So PLISSIT is a model that I'm going to just very quickly mention to you. This is the Foundation for ASEX certification system, believe it or not. And it was developed in the 1970s by Dr. Jack Annan from Hawaii. And it's a beautiful, beautiful model for moving a client forward over time. It begins with permission. It moves to limited information, just simple things like, I understand you're questioning your sexual orientation. Great. So let's talk about maybe how natural that might be, giving some information. And then specific suggestions, which is the heart, to me, of all great clinical sexology, great sex coaching, and honestly, sex therapy, and even therapy. So specific suggestions are, how about you go out and try this, and then come back and we process that. That's what it's really all about. And then intensive treatment or training. Annan's original model said intensive training, and that meant many, many, many things. But often it's intensive therapy. Oh, wow, that trauma wound is showing up again. We need to deal with that before we can get you back into the dating game, for example. So PLISSIT is what I train all of my professionals to learn as how to design a plan over time. And I'm going to tell you, it's going to sound weird the way it's going to come out. We repeat our clients almost every session, constantly giving P for permission. That is one of the deficits that boomers have, is the permission to grow, the permission to be okay in a more saggy body, you know, the crypt that hangs off our arms. Some of you are going, yeah, know that one. Even if you work out every single day. So, this is where permission comes in. Permission that it's okay to be dating 2 years after you lose your beloved. It really is. You're ready. Or permission to explore. Go get yourself a strap-on, you guys. If you're not capable of an erection, here's a toy. Here's a way for you to experience connection and pleasure and health. Sex is about health. So, this is my model. So my model evolved when I married that tried and true sex therapy approach with this cool thing called life coaching. And I went, well, what would be in that? Because I had to give a lecture, and I went, I don't have a lecture. I better make one up. And out it popped. And so this is my model in the world. I've trained thousands of people on it. And it's a holistic 5-part model that is about the whole of the sexual self. And it's the mind, the emotions, the body, and body image and behaviors. It's got 3 parts to it. That body, the physical realm, but body image, huge, 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 especially for women and men as they age. And men as they age, things that you might not be thinking about right now, like losing your hair. Oh, I'm bald. I've lost my sexiness. And I always tell them, some of the sexiest movie stars are bald. Let's look at a few images. And they go, whoa, because that represents high testosterone for some men. So reframing, constantly reframing and going for the positive. But in this model, E and S are what take it into the holistic realm. And that is looking at energy and looking at spirit. Not spirituality, not religion, but spirit. I like to teach that spirit in some ways is like a little blue flame, like the pilot on your gas stove. And it has to stay lit, and then it can ignite. I find that most boomers have the blue flame and they don't even know they have it or how to access it and ignite it. Okay? And I find it in people who are 30, 40, 50, 60, 70. Because that loss of the drive, the loss of energy around sex, whether you want to call it libido or you want to call it desire or just that aliveness, is not readily available for a lot of our clients. Agree or not agree? Yeah. Right? Yeah. I mean, I see a lot of sexual deadness in the world, wherever I travel the whole world. And I happen to be on my way back to Poland in 3 weeks, where I've been teaching 7 years and leading retreats. So any of you want to do a deep dive into your own stuff in a residential opportunity, that's something you can ask me about later on. Because we need to be cleared. We need to be clear, clean containers for what our clients may bring to us first. Heal thyself. Healer, heal thyself. So back to the MEBES model. Let's see if I go into it. So I love teaching it as a wheel. How many of you ever bumped into the work of Gina Ogden? Anyone here? Yeah, so Gina was one of my dearest friends. She passed away last year. And her contribution is the 4D wheel. And oddly enough, she and I were in different, we didn't know each other yet. We were in different parts of the United States, and we co-created systems at the same time that are almost an overlay. Cool. And so she has a wheel that's very similar to this. It's at 4-dnetwork.org, I believe. You can Google it. And this is another way of working with clients. And I do want to share something really cool as a concept for you, is that one of the reasons Gina formulated a medicine wheel is because she was trained as a shamanic healer. And she had people actually on a floor walk through the different parts of the wheel and tell their story from different parts of the wheel. Isn't that cool? So, and she marketed it by saying, are you working harder than your clients? To clinicians who wanted to find easier ways of eliciting what's going on for their clients. So I often do that as well, and do that in the intensive retreat in Poland. We're going to be walking the wheel a lot over 6 days. So I'm going to skip that. We've talked a little bit about issues related to aging and sexuality. For men, Again, they also often have retrograde ejaculation, so they're not ejaculating at all, which really affects their sense of manhood. I hear this all the time. And of course, prostate cancer. Men begin their sexual decline, at age 40, technically from a urological perspective. Women are just ascending around that time. And that's part of the weirdness, right, of heterosexual encounter and expectations, is that we're so different, yet we have so much the same. And for men, dealing with the effects on cancer and also lots of toys that have come about for prostate play. That's the positive side of that. Lots and lots of wonderful male enhancement toys. Low T, so as we age, our hormones, and they decline. I'm being dramatic, but wait. And that's true for females, it's true for males biologically. So our output declines, and testosterone, in my opinion, from all the readings I've ever done, I remain committed to the fact that testosterone remains the hormone of desire. It's the edge. It's what gives us hunger. That's the word I use with my clients, hunger, because they're hungry to have the hunger. That's a lot of what's not happening. So slower orgasms, weaker orgasms in males, again, negative body image issues and more. And then for women, again, how they look in the mirror, because we're socialized to fit this perfection expectation. You know, the imagery that surrounds us makes it really tough to look in the mirror. And so lots of us as clinicians have to be that voice to empower and uplift, and also help restructure and reframe negative self-talk and thinking. And hormones, as the estrogen declines and progesterone declines, and maybe there are surges of testosterone as female bodies age, sometimes there are other issues that happen, such as unwanted hair growth. Happens all the time with the imbalance. So then there's shame. I haven't even said that word yet today. Toxic shame is the biggest culprit in shutting anybody down around their sexuality. And it affects every age. But in the boomers, it's a lot connected to what can I do or not do, and how do I look to myself and therefore to others. Orgasm, again, for many females, slower to experience their orgasm. And desire, pain, drying up when estrogen declines, the vaginal lining becomes thin. So penetrative sex, especially if there isn't ample lube, and a lube that is thick, not too slimy. That's a really strange word, I know to say. But there are lubes that are too goopy, too slidey, like some of the silicone-based lubes. I prefer natural lubes. The Pleasure Chest has so many lubes you wouldn't believe it. And hybrids that have silicone and water base, like Sliquid, and some of those in the line of Sliquid. There are a lot of great products out there today. And body changes. So one of the things that a lot of women face, and it's true for males, but very much more so for the females that I talk to anyway, is atrophy. The old adage, use it or lose it, is real. And it has a lot to do with blood flow to the tissues. So for women who are aging and maybe not touching themselves in terms of masturbation, maybe they're only using a toy externally or internally, but haven't really touched themselves with their own finger if they're alone. Or they're in a relationship and that's off the table. I can't believe how many couples I work with where, well, we don't do oral, we don't do digital or manual, and he can't have an erection. And we have to really reconstruct your sexual behavior patterns together, don't we? And so there are things like the labia, the internal labia, the labia minora can be fused. And for women who do look at themselves and feel pride about their genitals and their sexual anatomy, they can feel it's another reshaming to see that, wow, where'd that go? It's fused, because if there isn't good blood flow and stimulation, things are going to happen. And that's a long conversation. So I believe I have only like 10 minutes left, right? I know. So couples, many things. You can look at your slide. I've talked a little bit about it. You can see some stats in your handouts. Not going to do this. This is in there you can look at. There are a lot of people who are not touching. And just like infants don't thrive without touch, guess what? Neither do we. So I always say to my couples or individuals who are in the boomer generation as clients, at least go get a therapeutic massage. You got to be touched. Even if it's not sexual or sensual, go get therapeutic touch, because touch is essential for thriving, even at our age. This is some of the research. You can see bothersome sex problems in at least half of the population that was in this large study. Desire difficulties, lack of vaginal lubrication, I mentioned that earlier, and inability to climax, which is orgasm. I don't use that word. So here's a sample case. So this was a real case. I go on cruise ships every few years, and I have private sessions. And this was when my partner Robert was alive. We videotaped them with consent and used them for teaching purposes. And this was a real couple. This was one session, and so much happened in 1.5 hours that they transformed them. So this is the description of them. They were in their boomer years, for sure. And they had been together 7 years, and they were workaholics. That's a really important key, because a lot of their life force energy went to serving others. This is classical, okay? And he had like so many years of graduate school. He was a licensed marriage and family therapist. Those are my toughest clients, by the way. And they ran a clinic together where they lived. They were on a cruise, so they came from another part of the country. And they were both recovering alcoholics. So I go on these tours with my friend who leads sober tours, and that's why they were part of it. And they had never, in 7 years, ever talked about sex. They just did sex now and then. So he was the one who yak, 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 yak. Very cerebral, driven. Everything had to fit logically. He was worried about what was going to happen as he aged. She was 10 years or so older. And again, work overwhelmed. Work, 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 work. But he also would set up their spells where they would go away. They'd go on a weekender, or they would go on a cruise to get away from work, 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 which was draining them. And he was the sexual initiator. So this is a key question we have to always ask our couples: who's initiating and who's not? And where are you on a continuum? You want sex. I once had a couple, he wanted sex 3 times a day, and she wanted it once a month for 3 hours before her period. That was a tough case. And another conversation. But he felt, being an alcoholic for a lot of his adult life, he had never really had a lot of sober sex experience, and he had never been able to read women's cues. It's so interesting. But that became a foundational piece of their puzzle. And so she was very withdrawn, and her body language was like, and yet she was a psychiatrist. Notice, marriage and family therapist, psychiatrist. Just make a mental note of that. All the training in the world, and never talked about sex, and so scared and vulnerable and shut down and undeveloped sexually. So she had a history of being wild. That was her word, wild woman in her early days, but things had slowed down. She also broke her back, so she had a lot of legitimate reason to avoid sex because of pain and recovery. But she really wanted to reconnect with him. That's why they got on the cruise ship, just to meet with me. They were so dedicated to repairing what was not working in their sexual dynamic. And she used this word: she never felt horny anymore, and never once initiated sex. So it was really, and she felt so much body shame. It was just unbelievable. So again, work. And this is them. So you can see this is a powerhouse of a woman at her work. She's recoiled like a little child. And here's him. He's so exhausted. look how tired he looks. And they love each other so much, and they're so disconnected. So what I did is I used the MEBES model approach, and I normalized and validated them. Those are the two key words in all good therapy and coaching. Normalize and validate. But don't tell them there's a normal. Don't use that word. Replace that word with, am I normal? Get rid of that, and don't say, well, it's normal to have, for 35-year-olds to have sex 2.5 times per month, according to one study. Don't go there. Encourage them to know who they are and find their baseline of what's natural. But normalize. You're okay the way you are. Now, where do you want to go from here? We can do that together. So part of what happened, and what was so cool, is that we realized the biggest deficit was that he couldn't read women and she didn't know how to ask for touch or sex. And so we created a device where she would say to him, can we have some sexy time tonight? And she would text that to him. Or she would ask him for sexy time, because I said, what if you went to bed naked when you wanted sex and you lay there and that was your signal? She said, oh, but I always sleep naked. So as we're working, we need to really ferret out how our clients are together. And Sunday morning was their ritual in the hot tub, and that became a point of check-in. So I'm not going to go through the rest, but summarizing the three top issues are misplaced expectations and negative thinking. And defining sex as an ideal instead of what's realistic for this couple or this individual. On the emotional level, helping them with performance anxiety. Most of our couples and our clients live in pressure cookers. I'm going to tell you that if you don't feel that they are around their sexual behavior. We need to help let steam be let out at the top. And it's related to function. Performance, a word we have to help them eliminate. Stop doing a performance and get into the moment and experience what's happening. Experience pleasure, experience connection, experience health. And the physical changes, helping them understand what's real. If you have clients who are older, who have had 2 knee replacements, they're not going to be doing doggy for a while, okay? And if they think they should because they did, you're that voice to help normalize that and validate them for what can you do now. And the bonus is having enough life energy for sex and finding out who you really are. That's what my work is about. My work is about helping people find what I call sexual self-realization. Who are you really? That's what, to me, all of our work is really all about. And you can help your clients, you can help them find alternative ways, help de-shame them, and these are my final tips. Use it or lose it is real, so encourage all of your clients to keep masturbating if they're not in partnered relationships, and even if they are, because it's healthy. And be healthy. So there are health practices that also have to do with staying sexy and sexually functional. I believe in coaching my clients to experience joy and pleasure as much as they can. And to break those patterns, especially patterns where you keep failing and then you wonder why you don't want to go back to it. So many of my clients have an aversion to touch, an aversion to sex, because it has failed for them and they don't know how to really make it work. That's the work that we do. And be okay and have gratitude for what is. The fact is, I'm standing on the earth alive. I've got to be grateful for that instead of running, if I were my client, running the negative chatter that goes on in the mind. And older sex can be the best yet because there's no pressure. There's no pregnancy to worry about. There's no, many of them who might be retired, who don't have the pressure of work, like, we got all the time in the world. What a great way to fill it. And then finally, I believe when we teach our clients to give love to others, it comes right back. That love is circular, and love is a part of what I really encourage my clients to experience. So as a final thought, it says, so what do you say we experiment and try seeing other people? You're going to find those people in your private practices, and this is how to reach me, which you have in your handout. So And then I left you a flyer if you want to come cruise with me. Here's the hilarious part. First of all, 3 of my very best friends, who are also boomers, who are very famous sex therapists and authors, are coming with me. And secondly, hurry up, the glaciers are melting. And that's not a good thing, but that's why we're going, because it's on our bucket list. So feel free to come and join us. It's going to be awesome. So thank you, everyone. I know I'm supposed to be quiet now, but thank you so much for your time and attention. I appreciate it. Thank you. So questions? Any questions that have come up for anybody? Yeah.
You mentioned exercises for accepting your body.
Yes.
Can you speak on that?
Yes. So there's a classic exercise, which is called the mirror activity. And the way that it works is that you teach your client, if that person is in a relationship, you have to read the relationship dynamic first. But the process is about looking at one's body in a full-length mirror, ideally unclothed, and speaking to the parts of yourself, your physical self, starting at the top of the head and going all the way through the body, and saying things like, I see my hair, what I love about my hair is. I see my eyes, what I love about my eyes is, and all the way down by pushing them to the positive. And it's a deeply emotional experience. And then if a couple is ready, and you have to read that, if they're ready and they're courageous enough, they can do it in front of one another. And then they can share feedback about it. One of my video programs, I think it's Great Sex Over 50, for men or for women at lovingsex.com. Actually, there are 2 DVDs that stream at lovingsex.com that are about aging and sexuality. They were made in 2008, and I would remake them if I did them again. But the teaching points are there, and there's a couple that show that. They demonstrate that. So that's one thing. And then really self-talk. So much of it is self-talk and the power of things like affirmations. Neuroplasticity means that we can really reprogram what we've been saying to ourselves or hearing or thinking by replacement. So if, this is Dan Siegel's metaphor, you have a path that you've trod so many times and it's now barren, nothing grows on it. Now start putting something fresh and planting new seeds. So that I work with any modality that resonates with my client to help them restructure their self-talk, because everything begins at mind. And then in my belief system, and professionally and personally, mind creates feeling and behaving. And so when we alter the thinking part, which is why MEBES has a hierarchical structure, MEBES, but also a wheel where energy runs everything, then we can help that client look at, maybe even use the wheel and say, well, what are you telling yourself from this part of you? Does that make sense? Mm-hmm. Yeah, any other comments or questions? They've left us alone, so no one's coming in with a hug. Anything else? Anybody? Okay. Thanks, though. I really appreciate being here with all of you. And you know how to reach me if you have a case you want consultation with. Feel free to reach out to me. I don't do that very often. I spend 90% of my time running my online program. And I take a few clients who are only clients who are referred by their therapist. Yeah.
Are you doing sex supervision?
No, I don't, because I'm an educator. I'm not a mental health. I'm not licensed mental health. Otherwise, I could do sex therapy certification, but I'm not, and I'm not doing education either right now. I'm too busy. It's rare for me to have a day that I can be with you. Yeah. Hi. I know. How are you?
I took so many classes with you. I did my SAR with you.
I remember.
You know so much, and it's such a joy. I'm a licensed marriage and family therapist, So my emphasis is more on doing the deep therapy.
Yes.
But what I learned as a sex therapist is amazing. Right now, I'm working with a man who is a pornography addict, and he's masturbated so much, he can't even get an orgasm if he has a person.
Yeah.
But I went, oh my God, what am I gonna do with him? But when he came in, I got to his heart level.
Yes.
And the other day he said, it really isn't the pornography, and it really isn't the sex, it's what happened to me as a kid that has caused this. So but everything he's ever taught me and what I learned with ASEC,
Yeah.
I went, what am I gonna do? And I went, you're gonna just see him as a human being.
Exactly.
He's a lovely
Yeah.
man. And he's cut down on the pornography and the masturbation.
Beautiful.
So it's wonderful. I just thought I would share that.
Thank you. And the movie Don John is a really great example of that. And sometimes I use cinema education for clients and all the trainings that I do as well.
But Emma, she's the best teacher in the world.
Oh,
I
thank
love her.
you.
She's fantastic.
Thank you.
Yeah.